On this edition of Veterans Health Watch, we'll learn about the VA Maryland healthcare system's research programs that utilize exercise and robots to help keep older veterans healthy or to recover from a stroke.
We'll also learn about the VA's new Family Caregiver program that provides additional support to veterans who choose to receive their healthcare services at home.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your host, David Edwards, and I'm happy to be joined by my co-host, Kenya Griffin. Kenya, thank you for being here.
Thanks for having me.
Joining us today is Dr. Andrew Goldberg, the director of the Geriatric Research Education Clinical Center for the VA Maryland healthcare system, and Dr. Alice Ryan, a VA career research scientist. Thank you both for being here today.
Thank you.
Thanks, David.
Dr. Goldberg, I understand that you were recruited by the VA in 1990 to come and create the Geriatric Research Education Clinical Center. Can you tell us a little bit about the history of how this all got started?
Sure, it's my pleasure. The GREX, or what the acronym is for the Geriatric Research Education Center, was established in 1975 by the VA when they realized a need to improve the health of older veterans because of the specialty of geriatric medicine and the need to provide care for people who are disabled and suffering from chronic diseases. The GREX have led the mission of the VA in providing outstanding care for older people, advancing the field of research in geriatrics, and also providing a home base for training geriatricians in this difficult time when medical practice is becoming so technologic that we really don't focus on patient-centered care. So the GREX have provided a base for training, and almost every leader in geriatric medicine in the United States has been trained at some point in their career in a VA. There are now 20 GRECs in the VA. We were number 13, and they've continued to be developed up until the year 2000. When we got our GREC, its mission followed the mission for Healthy People year 2010. That was our goal, to improve the health of older people by helping them assume a more healthy lifestyle. That means exercise, weight control, environmental factor control, living well, and stopping all of the habits that are associated with bad health. We also tried to integrate teams of caregivers. So we had interdisciplinary teams of social workers, pharmacists, dentists, providing care for older veterans. Our nursing staff, we have nurse practitioners, and these nurse practitioners have provided important care for our veterans. The goals of the VA have led to our ability to provide better care and better training for older veterans. So we have research, we have clinical care, we have training, and we work with our affiliate at the University of Maryland to train primary care doctors to care for older people.
Outstanding.
And Dr. Goldberg, why is the research conducted at the GREC so important?
Well, our GREC's mission is to improve the lifestyle of older people and their health through just getting them to practice healthy lifestyle habits. So we focus on diet, regular exercise, taking your medications, and stopping those bad behaviors which hurt your life, like smoking, illicit drugs, the non-compliance of not taking all the medicines that your doctors give you as you grow old. If you have a grandmother or even your parents, you see them taking 7, 8 drugs. Almost everybody in America over the age of 60 is on a statin. So we're giving more medicine, and we try to educate our older people to take these medicine. You see the plastic pill boxes, the 7 days. We teach our patients how to divide up their medications. We counsel them on what's important, and we, more importantly, provide them with opportunities to participate in what we call clinical demonstration projects to show the benefits of exercise and weight loss. And Dr. Ryan is going to talk a little bit about this because she's one of the scientists who I've recruited to combine with the clinicians so that we translate her discoveries into the clinics to improve the health of older people.
Well, that's a perfect segue. Dr. Ryan, specifically, could you talk about the focus of your research?
Sure. Like Dr. Goldberg mentioned, we study the effects of lifestyle interventions. So aerobic exercise training, resistive training, nutrition and weight loss programs, and how they can reduce risks for cardiovascular disease, diabetes, stroke. And so we study the cellular mechanisms. We look at changes in the muscle, in the adipose tissue, in bone, and we can show that exercise can reduce and change how you mobilize your fat stores, how you can increase your bone density, or you can have muscle hypertrophy with strength training in very different populations, people who've had a stroke, people who are just overweight. And we try to tie all these things together and show how we can improve the lifestyle and health of older veterans.
Well, Dr. Ryan, how does the heightened prevalence of obesity in the veteran population increase their chances of suffering from a heart attack or a stroke?
Yeah, it certainly does. We can store our body fat in different places. We can store it in the abdominal area. We can store it in our muscle, and we can modify those fat stores, and we can change how we metabolize our blood sugar, and we can do that through exercise, and we can reduce the risk for diabetes and stroke through these lifestyle interventions.
Dr. Goldberg, what are some of the future goals of your researchers in the GREC at the VA?
Well, the GREC is very fortunate that we have both MD, basic science, and health professionals all collaborating in our research. So it gives us many opportunities to advance the science of exercise and diet in improving the health of older veterans. The big problem facing veterans today is the obesity epidemic. 70% of veterans over the age of 50 are overweight or obese. 35% of them are obese. So that means you have a body mass index above 30. And indeed, in our clinics, the BMIs of our veterans are 35 to 40. And if you think that 40 years ago, that 60-year-old veteran was one of the fittest people on the planet, it's really scary to think that these people have gotten sick and their health has deteriorated. So the importance is that through our research, which focuses on lifestyle, we can hopefully reduce medication costs. We can get these people participating and able to return to work, socialize, remain active in the community. And these are things which prevent accelerated aging. They just prevent the declines in function that occur. We try to get people out of their house into senior centers, and the VA does such a great job with that. There are senior centers all throughout Maryland. I've gone out to American Legions. I've gone out and given talks at senior centers, and that's critical to helping these people improve. What I'd really like to see as these veterans have arthritis and are overweight is putting more athletic facilities that are good for older people. Swimming pools where they can walk, places where they can get exercise to keep their joints and keep them more mobile, and more importantly, where they can train their balance and do things to prevent falls, which is a huge problem in people as they age. So we're trying to look at the future and trying to improve things to allow these people to live a healthier lifestyle and be more participatory in their activities.
Well, we have to wrap up this segment, but I'm sure some people are now interested in your studies. How can a person, and not just a veteran, learn more about participating in one of your studies?
You can call our recruitment hotline. We have one for overweight people and diabetics, and we have one for spouses also. And we also have a hotline for recruitment of patients with disabilities into exercise programs for stroke, as you're going to hear about from Dr. Forrester and Dr. Wittenberg. So there are lots of ways that people can come and participate in our programs. We have a 5,000 square foot exercise facility in the VA currently, and we'll be moving to new facilities just down the street on Fayette Street, 200 block of Fayette. And it's a beautiful building, it's well lit, there's easy access, and our veterans can come there and participate in a wide range of physical activities to improve their health and quality of life.
Dr. Goldberg, Dr. Ryan, thank you both so much for being here today. I think this was very educational for our viewing audience. We're going to take a break right now, but when we return, we'll be learning about robots and how they can help with stroke rehabilitation, so stay tuned.